give us a little bit of reflection, both on your family's experience of service delivery during the pandemic, and perhaps your first impressions of the information that Grace and Vanessa presented.
Absolutely. Thank you so much. There were several emotions I felt when I saw the presentation. A lot of yes moments. Yeah, makes sense. Yes, I've seen that. I've heard that. A lot of moments that inspired some in me that we need to change the system. We need to support families better. We can do better. And then some deep relating to some of the things. And I think one of the things that definitely struck me and almost brought tears to my eyes was the fact of, was 10% felt that they would be willing to surrender their children to the ministry. And, in thinking about that for myself in moments of deep frustration and not knowing what to do, it's actually the most selfless feeling of just maybe someone else can do this better than I can. Maybe I'm not the person to do this. And so I really related to that and felt really such compassion for those families going through that. The pandemic for our family had a range of impacts. It was in some ways good because the social pressure was taken off my son. And we as a family could really focus again on what is important. So it really helped. My son could kind of carve out that academic time without the social pressure, and then maybe not having to interact with his peers as much. It brought some relief for us in some ways, but it indeed was very, very stressful. The pressure of now moving your job to home and having children at home, and that fear of, am I doing it enough? Am I good enough? Are we providing what we need to provide? And then, to be honest, the lack of communication from the ministry was rather concerning. I think it was very challenging. Just kind of, we were waffling and floundering in some ways, and waiting with great anticipation to what the ministry would say. Or, I saw these supports coming for other demographics of seniors and different things, and I was kind of waiting with bated breath, and was a little bit disappointed in their response. So, yeah.
Can I ask, did your son eventually miss the social interaction or not?
No, he didn't. No, he didn't. He just thrived being with his people he knew, and then those Zoom, we would obviously coach him through that, but we didn't have any therapies at the time either, because that social interaction would have been too hard for him.
Right. Okay. Thank you. Well, I think we're going to return to quite a few of those issues later.
Okay, yeah, I just want to thank you again for presenting this beautifully and well organized presentation. And I think the research well presented what the family have experienced and have thought, and that's really a great voice for our families to other communities and the governments. And I just want to thank you. And then while I'm hearing your presentation, I have thought about how to maybe improve or cooperate with other communities, and how to deliver this kind of a voices to the government ministries, and how we can develop among our family groups to improve the family quality of life. That's all things that I occurred to my mind.
Yeah, my son's school did a lot of worked really hard to get them back into class, because I was very, very concerned about them regressing. And so that, they even had their teaching assistants come and pick them up and take them to the park or go for a bike ride with the school counselor. And so they worked really hard to stay connected with them, which I was very helpful. So, but working in more rural communities where you have to travel on logging roads to get there, and where they don't have Wi-Fi or self-service, and I think that a lot of those communities already lack the services, so they weren't really affected by it. But it's definitely opened my eyes as to what services they're lacking, and yeah, a lot of the communities around Fort St. James went on complete lockdown, where they weren't allowing people in access to the communities. So yeah, it was definitely really hard to maintain that connection with the families. And yeah, I know the organization I work for, we did quite a bit of legwork to make sure that those families were still supported. So yeah.
And can I ask, in that part of BC, has COVID been particularly problematic, or have you got off lightly?
There was quite a few cases in Fort St. James at the very beginning, where they had called in reinforcements, kind of thing. A lot of the outlying communities, however, like I've known of some families who had to relocate to Prince George and be put up in a hotel room because there's no health services available in their community. So they and so the ones that did test positive, like they would uproot the entire household and bring them and put them in a small hotel room. Yeah, so it was pretty disruptive that way, but.
And can you just tell us a little bit about how things are there at the moment?
Well, they were the more rural communities, and Fort St. James, I think, were probably one of the first communities to receive the vaccine. Right. So they're starting to open up a bit more. I'm able to. There was one community I work with. They have that I wasn't able to go into the community at all for about 2 or 3 months. I was able to send stuff up on their delivery truck, but yeah, so I started going up again about 2 weeks ago. So they're starting to open it up to services, but we still can't go home to home.
Okay.
But
okay, thank you. Yeah. I'm sure there'll be more questions for you about your experience in a very rural part of BC. And so finally, we turn to Deborah. Deborah, for you, what are the key take-homes from this?
Right. For me, I was the most, I thought the research was terrific. I thought the fact that Grace and Vanessa actually asked questions of community partners as to what the areas that should be probed, that was the most important. That was the most important starting point. And I think, the fact that My Tax and Kids Brain Health Network were willing to fund this at very short notice, that was impressive. But it's the long-standing relationship, I think, between these researchers and the community that allowed this to happen so quickly, because research doesn't usually move this quickly. So that impressed me. I think like the other panelists, I was very shocked and moved by the idea that nearly 9% of families were considering putting their kids in care. And I knew that from the calls that we were getting, that was because the families were just so desperate that their children were not safe, that they could escape in the night. The parents were so exhausted that they might hurt each other or themselves. That was important. I thought, it so much echoed the issues that we were seeing at ACT. And I think probably the most profound area for me of this research is that it really illustrated what we were hearing from the community when people would call us and ask for help. We had very quickly Stephanie Porter, who you've heard from today, set up our COVID-19 resources page. And we try to collect the information on from government as to what parents were eligible for there. And we were very frustrated at that process. And, you know, it doesn't surprise me that the families who responded were complaining about, you know, not just the lack of respite funding, which was really important, but not being able to find out information, even to know that that might be available for the small minority who received it. You know, their calls for flexibility was what we heard about constantly. And just the fact that it was, you know, from those of us, this goes, I must say, well beyond the autism community. This was throughout those families who support children across the age range who had significant needs for support. And so those were families who had children with physical disabilities. But one of the theme that they picked, the researchers have picked up on, that we really saw, was that families could not get information about what was available. And as Carrie pointed out, you know, they kept waiting, and we were searching frantically and calling people and not being able to get that information. And to the point where I can remember conversations I had with the minister at the time, she's since been replaced, with the deputy minister, with executive directors, and saying to them, you realize you have the autism funding portal. You can communicate immediately with almost every family in the province, and that's nearly 19,000 who are, and that's the majority of families who have children with special needs who receive services. You can contact them immediately. You don't have to do a press release. You know, you don't have to wait for ACT to see if we can find that information. You can do it. To date, we still have not seen the Ministry for Children and Family Development use the autism portal to communicate with families, which meant that individual social workers were having to sort of field questions, and those families were dependent on whether their social workers considered them to be high needs or not. And often for families who have children with autism, they've never spoken to their social worker, and the social worker doesn't know the family. So,
and can I ask, Deborah, do you have any sense about why more use hasn't been made of the portal?
Well, I was surprised that both the minister at the time and the deputy minister were surprised that it even existed. And that you know, you laugh, but, you know, it's one of the things that, you know, being, you know, my son is 30 now, so I've been watching for a number of years the evolution of government services. And I think what's really happened in the last decade is that effectively child protection and children and youth with special needs services have been amalgamated. And it's overwhelmed, you know, when my son was diagnosed over 25 years ago now, he received services from a completely distinct part of, you know, within social services. And child protection, they didn't defer to child protection. Children and youth with special needs, or the equivalent then, was fairly independent. And I mean, if those workers decided that the child was in need for protection, they could call in protection. But right now, the reality is that children and youth with special needs social workers have almost nothing to provide families. And as one of our comments that we received, that families are, you know, when they're desperate, they're told, you can give your children up to child protection. And I actually had the most amazing experience, and not in a good way, arguing this with the minister, very, of course, respectfully, okay, terribly respectfully. But the point that families are being pushed to put their children in care because children and youth with special needs social workers can't provide them with sufficient amounts of respite, or, you know, and this has been an ongoing situation well before the pandemic. So I think that the fact that the upper echelons of MCFD have so little understanding of how what they are doing is profoundly and negatively affecting families who have kids with special needs, including autism, but not only autism. This goes across the board, particularly Aboriginal families. and particularly poor families. So those were my sense. When I looked at this research, I was so impressed that they'd managed to pull those things out.
Okay, thank you, Deborah. I'm sure we'll come back to some of those points in a few minutes' time. We do have some questions from the audience, but before we turn to those, I just wondered if the panelists had any questions for each other or for Grace or Vanessa, or indeed whether Grace and Vanessa had questions for the panelists.
I have a comment. So I think that finding about the 10% statistic is very shocking, but I think it's even more shocking when you put it in context that our sample, the majority of participants that completed our survey, we might predict that these families have greater resources. They needed to have time to complete the survey. They needed to have access to a computer, internet, and things like that. So I can't even imagine, more marginalized communities, what they must face. And if they had completed the survey, right, what kind of results we would have, what kind of results we would have got, and things like that. Where families don't speak English as their first language. I know Bo saying, he interprets and he translates a lot of the resources into his own language, and that's a lot of work for one person. So just building capacity, I think, in this area and having our surveys in multiple languages, I think that's kind of should be a goal for research, I think. Right, Grace?
Okay, thank you for that, Vanessa. In fact, I was going to turn to Grace because one of the questions that came in from the audience was wanting a bit of clarification about this notion of resilience, which is a common notion amongst researchers, but I think if you ask the man in the street, means different things to different people. So I wonder if you could talk about that underlying concept for a moment, Grace.
Yes, sure. I think that is a kind of common misconception that somehow resilience or resilient family means that there's something specific about that family, like it's a trait that the family has that makes the family resilient. But it's much the opposite, and that is that it's not a trait of the family per se. It's really a combination of factors that come together to create resilience. So, protective factors and supports and services and extended family support, a variety of things that work together to help the family have resilience. So, and by no means do we mean that there are special families out there that are, have special powers.
Okay, that's a very helpful clarification. Another interesting question, you may not have data on this, was the extent to which families' more general relationships were supportive during the pandemic. So I think the person here, the questioner, is referring to the sort of neighborhood the family live in, their level of education, their professional background. Did you have that sort of fine-grained detail, or was that not possible in this survey?
Not really possible in this survey. I mean, we do have the postal codes, and those help us to determine general sort of neighborhoods where people might live. And neighborhoods, have an index of sort of affluence or, an index of how many resources a community might have. But that's rather, like on a gross level. We really wouldn't be able to say much about an individual family other than their income, I suppose.
Okay. Let's move on to a couple of other questions that we've had. One is very easy, which is wanting to know what has happened across BC in terms of diagnosis of children because of the pandemic. Either Stephanie or Deborah, I'm guessing you might well have your finger on the pulse of what's happened to diagnostic services.
Well, I can report what families are telling us, and I know from professionals that from a member of our board actually, who's in Prince George this week, I think, doing diagnoses. So I know that they are happening, and at BC Children's Hospital through the BC Autism Assessment Network. But a lot of the time they're trying to do part of it at least remotely. And it's not always easy for families. Well, you can, I think we all know that that's difficult. One of our commenters today said that she was told, or he was told by their social worker, that there was a 2-year waiting list for BCAN, for publicly funded diagnosis. And that's not actually surprising, given that even before the pandemic, it was sometimes as high as a 1.5 years in many places. And it depends, of course, where you live in the province, how long the publicly funded diagnostic waiting list is. I know that that here on the island, on Vancouver Island, because I'm living in Nanaimo, that even for private diagnoses, it can be a year. And that in itself is that's where things are really showing that the deterioration. But again, this is how the problems prior to the pandemic have worsened the situation tremendously. If we hadn't allowed as a community for diagnostic waiting lists to be that long, I mean, the standard in the province, which has never been met since it was established 15 years ago, was supposed to be 3 months for a waiting list. And ironically, when my son was diagnosed back in, I don't know, 1994, the waiting lists were shorter then than they are now. So, you know, it's a really...
Yes, we've just had an audience member in Kamloops say it's 2 years in the public sector there and 1 year in the private sector. And I think the issue with diagnosis is not unique to autism. The entire medical system is under strain in terms of a backlog of people who've not had either diagnosis or treatment for life-threatening diseases. And that's not a problem specific to BC or Canada, it's a worldwide problem. So I think the pandemic has had significant impact on mortality and morbidity in terms of limiting access to care for people with all sorts of different conditions.
I know that here in the north, they like I had to travel to Kelowna to get my my son assessed last October, and yeah, it's very hard to find anybody to even assess your children up here, let alone yeah, being able to afford to travel and whatnot for a lot of the families I work with. So
I just want to add, because I think that, you know, we've really focused in on children today, and that is the focus of the research. And yet I know that Dr. Bailey and Dr. Irochi both are very engaged, as is ACT, with trying to find some kind of progress on the difficulties that autistic adults face in trying to have a diagnosis and, you know, follow on mental health care. So that's, you know, this isn't just because of COVID. We started that work well before, and but the point that Tony has made, I think, very effectively is that COVID has just devastated our ability to keep up or improve the situation. And we need to make sure as we move forward and through this, because we're still obviously experiencing it. The pandemic is not over, far from it. So we really have to think about how for the future we change our system so we're not, you know, like we aren't losing years for these children and adults where they really need to have some They don't need necessarily extensive medical care, but actually getting a diagnosis shouldn't be ruled out because of your condition. And I don't mean, Tony, that it's only children with autism or adults who are being denied medical services, but I think particularly for autistic adults in the province and across Canada, the way in which there has been, effectively ignored their needs for diagnostic services has been really difficult during this period.
Okay. There is a comment from a member of the audience about the struggles her own daughter had to get a diagnosis, which she never got, although she knows she's on the spectrum, and her condition has certainly not held her back, as she's now a successful lawyer. It seems to me when we think about the pandemic broadly, it's sort of a stress test of the system. So stress tests are something we normally think of in finance. They're sort of intellectual exercise that governments engage in to see if banks could withstand a financial crisis. In other words, do they have enough capital reserves? And most of you will have noticed over the last few weeks, some people were wagering rather large sums of money on stocks moving in particular directions, and some of the world's biggest banks have lost billions and billions of dollars, but have not gone under because presumably their capital reserves were sufficient. So I think what the pandemic has done is just reveal what the existing weaknesses were, but exaggerated the impact of them. So, Deborah, governments can't fix everything at once. What would you see as being the top priorities that the responsible ministries should direct their attention to at the moment?
I think that from my perspective, nothing will change unless government changes its attitude towards families. So that, respectful engagement with families, particularly in the areas of, what are the key services, how to make the services more flexible. I mean, I'm very keen that, particularly in the area of autism funding, that it isn't, here's your money, just spend it as you will. Because if we don't have standards related to evidence-based practice, then that becomes something that is very easy then to pull the funding out. You do have to have standards. But right now, nothing has changed in the autism funding program since it was started in the early 2000s. It's totally rigid, and there is no, there's no built-in standards of assessment for how well money is being used and how the program should be adapted to meet current conditions. So it is very difficult, but I think for me, the most important thing would be to change the relationship between families and special needs social workers, so that families are protected from being pulled into the child protection system. Special needs social workers are much better trained, and that families can expect a relationship and proper support, and not judgment, and not to feel that they have only two options, put up or shut up in terms of their situation. So yeah, I think that to me would be a sea change. And if you could then feed up within the ministry to the leadership of MCFD, so that they're actually listening to the line social workers, because right now I don't see any communication happening there, and I don't think they're aware of what's going on the ground. And I think that lack of awareness was why, or that lack of relationship to reality between the leadership of MCFD and the line social workers, was one of the reasons that we have had such a difficult time in the province.
Okay, Deborah, I'm going to come back to you again in a minute, but Grace and Vanessa, on the basis of your findings, what do you both think are the priorities for government moving forward? You've sort of highlighted some of the shortcomings, but what would be the top priorities for change?
I would agree with Deborah that the government needs to listen to families more. The families are very diverse, although they're, you know, all trying to cope with, you know, a child with special needs or a child with disability, but they have very different needs. And, you know, having flexibility in the system is really important. In rural and remote areas, even more flexibility because the professionals don't exist right in the community. So these, you know, sometimes one community in the interior that we've worked with, they require more flexibility to be able to have, you know, professionals in the Child Development Center be able to deliver certain services or have funding funneled through that center rather than the typical sort of early intervention ABA model that's currently in place. So lots of things around listening to families, being flexible, and putting more priority on helping the family as a whole, not just the child. Thinking about autism or special needs, disabilities as pertaining only to the child is a big mistake. As we saw in, you know, the presentation today, mental health of the parent, the well-being of the parent, the well-being of the family is critical to the outcomes of both the children and the family as a whole.
So do any of the other panel members have thoughts about what they see as top priorities for the government in the light of what's happened with the pandemic?
I would echo what Grace and Deborah have shared. I think that's, you know, everything totally resonates with me. And I think, as Deborah mentioned, you know, even maybe just a streamlined way of communicating with us as parents, using the portal or doing something that's a bit more effective, because it seems to be rather haphazard, it feels like. I think that would be really good to have it streamlined. And I don't know, there is this sense of, I don't think it is good that MCFD, child protection and autism services are in one. Like it doesn't go well together. And you know, even today, a mom just texted me and she just said, I'm feeling so overwhelmed because I feel so guilty that I haven't used my funding. I haven't been able to use it. And I feel that this is such a gift I've been given, but I just can't use it. And I feel overwhelmed by it. And so I just think more of a relationship with your social worker to be able to help you use some of those resources, or even being able to carry it over. I was absolutely stunned at the fact that they would not allow us to carry some of that funding over. Just some flexibility around that. And I'm all for accountability. I think it is so important. I don't think it should be a blank check. But you know, parents know what their children need, and so you know, trust us with that. Mm-hmm.
I also re-emphasize what Grace and Deborah and Carrie, because this is very, very important. I think the government should trust the families, even though there are some families they might not trust, but most of the families love their children, and they know where to use and how to use the fund wisely to help support the kids. So, for example, Carrie already mentioned that until the COVID is over, the autism funding under 6 years old can use after the 6 years old, because they couldn't use the funding like more than 1 year. Then they already passed like 6 years old, and they couldn't use the funding for the 1 year or 2 years. And we don't know when COVID is over. So we need to extend until the COVID is over. They can use the funding they didn't use during that period. That kind of flexibility we need, and they need to trust the families. That's I want to re-emphasize this.
Those are really.
Laurie, did you have any comments?
I was just going to say, I think that there also needs to be a lot more CYSN workers. Like when I moved up here 2 years ago, from the Okanagan, like I had a CYSN worker there. So when I moved here, I contacted them right away. Still to this date, I've never met her in person. And it seems like the only time we're in contact is when I reach out to her. Now, we have one CYSN worker in the area, and she is she's in Vanderhoof. So she covers quite a few communities, right? I know of parents who didn't even know she existed or that there were services out there available. So I think they're overworked and there needs to be more of them.
Okay. Vanessa, I accidentally cut across you there, sorry.
Oh, no worries. I was just going to just building on what both Sang and Deborah and Grace have mentioned, just about the importance of listening to families. I thought it was really interesting when I was going through the survey responses and looking at the data, very few parents mentioned that they just needed more funding. Like it was only a handful of parents that said that they just, the solution was just more money. They have a lot. When I was going through the responses, there's so many innovative, really good solutions that parents have. They've really thought about this a lot. So I think it's so important, Grace and Deborah said, and both saying, just listening to families. They're the experts.
Okay, I'd like to try and turn this all on its head a little bit. And whilst I'm talking, Vanessa, could you pull up your recommendation slide from the paper you and Grace published? And I want to just read from the final bullet point. Government should protect and support civil society organizations and communities who play a critical role in implementing policies, protecting public health, and providing access to needed supplies, medical care, and social services. And I'm wondering if part of the problem we're discussing, and this is not specific to autism, but applies, I think, to many other conditions, it is perhaps the government is trying to do too much. And we've seen from around the world many good examples of governments realizing they either don't have the expertise or resources to deal with a pandemic and to move quickly, and have often just outsourced things to either private or voluntary organizations. And I'm wondering if, rather than hoping that MCFD and various ministries will become better at doing what they're meant to be doing, whether instead we should be focusing on them providing the resources for people with expertise and organizations in the community to take on some of these burdens. Deborah, can you respond to that?
One of the things that really has struck me over the years, watching how BC's developed its social services safety net for children with disabilities in particular, is that there is a number of times they have canceled really good services. So I keep thinking of the Infant Development Program, which was headed by Daniel Brynilston. And she was, it was a terrific service. And now we have no centralized voice for the IDP organization. So that's a really serious problem. Recently, I was talking to people in the North about the cancellation of the Success by Six program, and of course for ACT, our government contract was canceled about 3 years ago. So that really has meant that a lot of people were unable to access community services because there's no coherent centralized source of information. And because government, the services that were provided by the government, social workers were told not to tell families, not to discuss certain issues with families. And these were the issues that families wanted to know about. So I think that it's a really good point, Tony, that it's not just that we haven't created or we don't have a network of services that can provide support during a crisis, but when we actually develop things in the province, the service is pulled by whatever parties in power. Mostly, it's been done by both major parties in the province, but it links back to the lack of assessment. So instead of saying, let's do an assessment, an objective assessment of whether or not the service is useful and provides valuable service, and then decide whether or not it's worth funding. My concern also with the autism funding program, it's never been assessed. It's very vulnerable to being canceled. And I think, one of my concerns is we're talking in the province now about a new framework. And we don't know what that framework is. And it's always worrying to me that we're going to have a quick change without having done any research to see whether or not this is a good idea. So I'm not sure, Tony, if I answered your question properly, but that's kind of what I think about historically.
Can I add something there, Tony?
Yes, please do, Grace.
I guess I'm both a clinician and a researcher, but I guess from a research perspective, as a researcher, I'm always very frustrated about the lack of reaching out to us in the research world, in the academic world, for consultation or collaboration, where, as you saw in this study, we collaborated with a nonprofit organization with funding, opportunities, and we got together a study in like literally a month and had results after 2 months. I mean, why couldn't governments, work with us to find out what it is that they need to know, and quickly, implement something that is more based on what family really needs, on what the data is showing. I'm just always really frustrated about why that doesn't happen.
Are there any methods of support that have been used during COVID that were implemented in your community that you believe will continue on after the end of the pandemic because they were effective?
I think, I know that like my position in the organization I work in right now is somewhat of a new position, and I think that the organization I work for is also like very essential to a lot of these smaller communities, because we have doctors and nurses, speech and language physiotherapists employed with our organization that go out to these communities. It's been hard to, like I said, it's been hard for them to enter communities and whatnot, but luckily I have been able to, for the most part, try to maintain those services, whether over the online, and like if they were to come into my office, they could, the speech and language could work with the family in a private room, over Zoom or whatever. But I haven't really noticed any services like at all for older children. The schools do their best, but I can't see anything that's come since COVID that will stay, other than the federal funding for prevention and stuff like that for the program I work for, and just making sure that families are best supported to to stay together. And so we try to prevent that removal, that breaking of the family. And yeah.
Thank you, Laurie. Because the research was conducted in BC, inevitably our discussion has been very BC centric, but Deborah and Grace, can I ask, on the basis of your contacts with colleagues and peers throughout Canada and internationally, do you think the BC experience has been the common experience or fundamentally different from other provinces or other countries? And have you heard of any practices either elsewhere in Canada or in other countries that we should be thinking about implementing here, as Deborah pointed out, we're still not through the pandemic? Grace, do you want to go first?
Sure. So I, as far as I know from colleagues and even my colleague in Israel, the experience seems to be relatively equivalent. Although he said, Dr. Dinstein said that in his study, his COVID study, the families seem to be doing or expressing a less distress, somewhat less distress than our families seem to be. But we still have to compare those data more carefully. But I think what I'm hearing across Canada is very similar, and in fact, probably worse out east because of the numbers, COVID numbers out there. Yeah, I don't know, Deborah, what have you?
Yeah, Deborah, what's your feeling?
Based on the reports that we've been hearing from across the country, which we carry a lot of these on our Facebook page and internationally as well, the bar is set very low. And I think a common theme across Canada, and I'm thinking of the UK and Europe as well, is that people expect families who have children with special needs to sort of go on ice in times of crisis, that somehow you can remove all these services that keep families, barely with their heads barely above water, and that we're going to resolve the issues for the main part of the population before we get there. And particularly because we don't have, organizations to support families properly. Our CDCs, our child development centers are terribly under-resourced, et cetera. That puts us in a terrible position for being able to cope. And I think a lot of the bitterness you see from families, and I think one of our presenters mentioned it, I think perhaps Carrie did, was that we're watching the federal government really respond relatively well. Even the provincial government, I don't think many people are complaining about the actions of public health and being very proactive. And yet, when it came to children with special needs, it was the silence was immense. Now, there was a difference for adults who were receiving services from Community Living BC. They did a very good job of communicating and a relatively good job of supporting. But that was really different for children's services. And it seems to me that it was the same across Canada, that the services before the pandemic were poor, and the response times, it was as though, it's very difficult. Families are suffering alone in their homes. There's no video showing the equivalent of sending the army into seniors' homes and bringing out people in body bags. But we all know from those who work with these families that the suffering has been intense. So it's really, and families don't like to talk about their suffering because they don't want to look incompetent, because they are afraid of their children being taken away if they complain too much. So there's it's a very fine line, and I think that is a national and international phenomenon. I don't think it's exclusively in British Columbia, but to be frank, we're a very wealthy society. We have been very fortunate, in comparison to many communities across the world. And so it is particularly disturbing to me that the lack of responsiveness of those in authority.